Om Shri Sai Ram, invoking the blessings of the Almighty and paying our respects to Sadhguru Shri Madhusudan Sai, dignitaries seated on the dais, respected elders, doctors, healthcare professionals, delegates, volunteers here, and all those joining us live, students and staff, a very good evening and welcome to the concluding session of the All India Meet of Sai Swasthya Wellness Centers and Sai Arogya Secondary Care Hospitals, initiatives of the Sri Madhusudan Sai Institute of Medical Sciences and Research. At the very outset, we would like to welcome all the dignitaries on the dais. Dr. Sanjay Kumar, MLA, Jagtial District, Telangana. Dr. Prashant Garg, Executive Chair of L.V. Prasad Eye Institute. Dr. C. Srinivas, Chairman, Shri Sathya Sai Health and Education Trust. Shri B.N. Narasimhamurthy, Chancellor, Shri Sathya Sai University for Human Excellence. And our most beloved Sadhguru Shri Madhusudan Sai, Founder and CEO, Shri Madhusudan Sai Institute of Medical Sciences and Research, a global humanitarian who's spearheading service initiatives in nutrition, healthcare and education in over 80 countries. Once again, a very hearty welcome to all our dignitaries. Health is a fundamental right and not a privilege, based on one's social or economic status. In keeping with our national health policy, we at the Sri Madhusudan Sai Global Humanitarian Mission strive to make healthcare accessible, affordable, and available to all. Sai Swasthya addresses primary healthcare needs. Sai Arogya multi-specialty hospitals have been envisioned to provide secondary care services, particularly in rural areas. Over the last 3 years, 27 Sai Swasthya centers and 1 Sai Arogya secondary care hospital have been established across 9 states and have served over 300,000 screenings, 85,000 consultations, all totally free of charge. In our vision to address Bharat's aim of universal health coverage, we aim to establish a Sai Swasthya center in every single taluk and a Sai Arogya in every district. This is indeed a very special year as we commemorate the centenary celebrations of Bhagwan Shri Sathya Sai Baba's advent. In furtherance of his message of love and service, we aim to expand the Sai Swasthya network to 100 centers touching 1 million lives. Over the last 2 days, over 150 doctors, experts, administrators, and volunteers from our national Sai Swasthya and Sai Arogya centers across 9 states gathered here to exchange ideas, learn from each other's experience, and collectively define the way forward. We will now have a short video on Sai Swasthya Wellness Centers highlighting the mission's journey, impact, and the way forward. Can we have the video, please? May we now invite Ms. Amrita Roy Mukherjee, Chairperson of the Arogya Vahini Trust, to present a summary of the morning session.
Sairam and Namaste. Day 2 of the All India Meet began with technical sessions at the Atai Shaw Hall. These sessions focused on leveraging technology and optimizing its scope in healthcare delivery. Dr. Sriram Sisla, public health and telemedicine expert, gave a detailed presentation on the wide scope of its usage. Mr. Pala Sitaram from the Department of IT introduced the Sai Swasth and Sai Arogya HIMS and telemedicine platform. This platform was designed in a simple, accessible, and secure way, supporting both the medical and non-medical aspects of Sai Swasth and Sai Arogya healthcare services. For the benefit of all, a live teleconsultation was demonstrated. Dr. Amol Gaikwad from the Anjani Mashelkar Foundation presented on accessible healthcare through point-of-care diagnostic tools. His discussion included the use of POC diagnostic tools in health parameters, enabling early detection through high-quality innovations, empowering healthcare systems to identify and address health issues at the initial stages, leading to more effective treatments, reduced healthcare costs, and improved patient outcomes. Following this, Swayam Diagnostics, a health monitoring system, conducted a live demonstration of telemedicine equipment. A panel discussion by senior faculty members from our medical college, Dr. Anand Agarwal, Dr. Kulbhushan Bali, and Dr. Sri Harsha was conducted, through which the role of referral surgeries in tertiary healthcare was discussed. Later, queries from the audience were addressed. Dr. Devji Patel, currently serving as a public health and nutrition consultant, emphasized the significance of a comprehensive understanding of nutrition in promoting health and preventing diseases. With this, the Day 2 session of Sai Swasth and Sai Arogya program has come to a close. Sai Ram.
Sai Swasthya is not just a wellness center, but a transformative experience. This evening, we have 4 staff members who will share their experiences with us. First, we would like to call upon Dr. Nasreen Banu, a dentist, and she's a program officer of the Sri Sathya Sai Arogya Vahini. She's been part of the outreach team of Kolkata since 2018. Dr. Banu.
My most humble salutation to the lotus feet of Swamiji. I am deeply blessed to have this opportunity to to share my experiences in His divine presence. I'm Dr. Nazreen, and my journey began with Sri Sathya Sai Arogya Vahini Mobile Medical Services in 2018. Back then, we used to cover almost 45 villages, conducting more than 120 camps per month in rural West Bengal. With the commencement of Sai Swasth Rural Wellness Center program, a primary healthcare initiative of Sri Madhusudan Sai Global Humanitarian Mission, my roles got expanded, and I'm blessed with the opportunity now to conduct, coordinate, and organize clinics across 5 states. I collate data make a report and submit every month. And this has been a blessing for me. While doing the coordination of the clinics in every states in North and Northeast, we found out that our local community support is very much necessary for the smooth running of the clinics, along with the local ownership of the community centers. So we spoke with the elders there, and we had a number of volunteers coming forward for this. And while speaking with the volunteers, we found out that we have a great number of educated housewives, women in those villages who are not doing anything because of the lack of scope in those areas. So we spoke with them, and we started training them for our clinics, our centers. And we trained them for around 2, 3, 4, 5 months, and now each of them are capable of single-handedly coordinating the clinics from the beginning to the end. They can do front desk registration, they can counsel the patients, they can explain the prescription, when to take the medicine and when to avoid the medicine. They can guide the patients, and this has been a great help to us. Now, we are very much proud or honored to say that we have total workforce of around 150 members, among which more than 50% are women, and among them, more than 40% are from the local community. We have Shreya Ghosh in our, from the Ichapur Sai Swasth Rural Wellness Center, who can single-handedly coordinate a clinic very smoothly. Now, the word started spreading. So after training program started, now the already skilled and qualified personnel also started joining us. They wanted to lend support to the ongoing training program and also in participation to the smooth running of the clinics. We have Pronoy in the remote area of Sundarban. We recently started that wellness center. He is a GNM nurse, and he is now responsible for the operation of all the outreach clinics and the Sai Swasth Wellness Center in the remote island of Kochukhali in Sundarban. Likewise, we have Chandrakanto of Hijuli Sai Swasth Center, who is assisting the pharmacist in dispensing the medicines. So this is a very great honor for all of us that we are having a very heartfelt and warm support from the local community. Swami, at the end of the day, we have found out that no amount of peace or satisfaction is compared to the selfless service we can extend to the community in need. No amount of peace or satisfaction can be achieved. So, Swami, we pray to you that since the wheels have already started rolling, and now we pray to you to provide us with more opportunities so that we can carry forward your mission. And I wanted to mention this, that we have a small group from West Bengal who have come to pray to you for start of a hospital like Bapatla Hospital in West Bengal. We will introduce to the group to you later on. Thank you. Thank you so much, everybody.
Next speaker is Dr. Arshdeep Singh, who volunteers at the Sai Swasthya Center at Malewal village in the Patiala district in Punjab, a doctorate in waste to energy generation. He also works as the deputy lead in Round Glass Foundation that focuses on waste management, sports and sustainability. Dr. Singh.
Sat Shri Akal and Sai Ram. I am very thankful to Guruji, उनकी पूरी टीम, जो आज मुझे मौका मिला यहाँ पे आने का, आप लोगों से बात करने का, और जो आप लोग मेरे गांव में काम कर रहे हैं लोगों के लिए, उसका धन्यवाद करने के लिए मेरे पास शब्द नहीं है। आई विल शेयर 2 stories from my village and try to describe and conclude the requirement and impact of this mission. And main focus will be on requirement and impact. So first case is one woman from my village, करनैल कौर। 2007 में मैं अपने हॉस्टल से घर आता हूँ, छुट्टियाँ थी। आते ही मेरी माँ ने मेरे हाथ पे 1000 रुपये का नोट रखा और बताया कि उसके हस्बैंड की डेथ हो गई थी, अपने पिता के पास रहती थी, बच्चा बहुत छोटा था, पिता की डेथ हो गई। कोई देसी दवाई उसने किसी बीमारी की इधर उधर से लेके खाई, रिएक्शन हुआ, दोनों आँखों की नज़र है वो चली गई। उसके ऑपरेशन की रिक्वायरमेंट थी तो उसे वो 1000 रुपया दे के आने को बोला। जैसे ही मैं उसके घर पहुंचा, हालात मैं बयान नहीं कर सकता, टाइम बहुत कम है। छोटा सा कमरा, एक छोटी सी किचन, उसकी दहलीज पे बैठी वो खाना खा रही थी और जिस कटोरी में वो दाल खा रही थी उसमें 2-3 मक्खियाँ गिरी हुई थी और शी वॉज टोटली ब्लाइंड। वो खा रही थी ऐसे, उसे दिखाई नहीं देता था बिल्कुल भी, बच्चा बहुत छोटा था। तो मैंने हालचाल पूछा, ऐसे ही वापस आया, बोल के आया कि मैं फिर आऊँगा, 1000 रुपये से कुछ नहीं होने वाला था। उससे आगे करने की उस टाइम पे मेरी परिवार की हैसियत नहीं थी। दोस्तों से बात की, 500 रुपये हमने कलेक्ट किया, 13,000 रुपये उसकी एक आंख का ऑपरेशन हुआ। भगवान ने कृपा की, 6 महीने बाद मुझे इस काबिल बना दिया कि दूसरी आंख का ऑपरेशन मैं खुद करवा पाऊँ, वो हो गया। एक्चुअली करने वाला वो मैं या हम नहीं होते, करने वाला वाहेगुरु है, भगवान है, वो बस चुनता है हमें और ये हमारी किस्मत होती है। तो यहाँ से कहानी शुरू हुई, चलते गए। सेकेंड स्टोरी इज यंग गर्ल फ्रॉम माई विलेज, जयंती। उसकी माँ हमारे घर पे सफाई का काम करने आती थी। बहुत छोटी थी वो, पढ़ाई में बहुत इंटेलिजेंट, लगता था पढ़ेगी कुछ बनेगी। जैसे ही +2 पास की, पूरा परिवार जो है वो खेत मजदूरी का काम करता था। 12th के बाद पढ़ाई बंद, खेत मजदूरी में उसे डाल दिया गया। तो मैं उसे देखता था, बड़ा मन दुखी होता था कि ये नहीं होना चाहिए था। दिमाग में पिक्चर भगवान ने कुछ और बना रखी थी। तो इन 20 सालों में जितना वाहिगुरु ने हमें चुना, हम सेवा करते गए। बहुत लंबी चौड़ी वो कहानियाँ हैं। विवेक भैया को मैं जानता था, पहले हम जॉब करते थे इकट्ठे, लेकिन अब वो कहाँ हैं, क्या कर रहे हैं, मुझे नहीं पता था। 12 या 13 जनवरी को मैं उन्हें कॉल करता हूँ कि भैया कुछ गांव में अच्छा काम करने की आपसे सलाह मशवरा करना है, बताइए कुछ। तो उन्होंने गुरुजी के मिशन के बारे में बताया, अपने काम के बारे में, टीम क्या कर रही है वो बताया। तो 19 जनवरी को गुरुजी की पूरी टीम मेरे गांव में आ गई। 12-13 जनवरी को बात हुई, 19 को साइट सिलेक्शन, पंचायत के साथ मीटिंग, सब पॉजिटिव, सब ओके हो गया। और 31 जनवरी को हमने उद्घाटन कर दिया हमारे गांव में पंजाब का पहला साइंस स्वास्थ्य वेलनेस सेंटर। और करनैल कौर जैसे 35 पेशेंट पहले दिन वहाँ से खुशी खुशी दवाई लेके गए। और जयंती को वहाँ पे जॉब मिली, वो वेल ड्रेस्ड, बहुत ही अच्छी तरह प्यार से लोगों को हेल्प कर रही है वहाँ पे। उसकी अभी पढ़ाई की भी फर्दर प्लानिंग हो गई है। तो देखिए, दिक्कत ये है कि गरीबी बहुत है, गरीबी और अनपढ़ता। मेरे ख्याल से इससे बड़ा श्राप कोई नहीं है। लोग बीमार हैं, अवेयर नहीं है क्या करना है, कहाँ जाना है। अगर कोई गाइड भी कर दे तो पैसा नहीं है, वो अपने इलाज को कंटिन्यू नहीं कर पाते। दिहाड़ी मजदूरी छोड़ के दूर शहर में जाना उनके लिए बहुत मुश्किल है। तो बिल्कुल जो गुरुजी का मिशन है, रूरल बिल्कुल कोर इंटीरियर में ये फैसिलिटीज़ वहाँ पे जो टीम अब दे रही है, महीने का 200 से 250 पेशेंट वहाँ पे आता है, आसपास के गांव से आ रहे हैं। स्क्रीनिंग हो रही है लोगों की। जो बुज़ुर्ग कहीं जा नहीं पा रहे थे, बिल्कुल पास में जो लाठी का सहारा लेके चलते हैं, वो भी आराम से आ रहे हैं। और वहाँ का माहौल है वो आम क्लिनिक और हॉस्पिटल जैसा नहीं होता, वो बहुत सुखद, पॉजिटिव, स्पिरिचुअल होता है। और वो मैंने महसूस किया, दैट इज़ ड्यू टू एब्सेंस ऑफ कैश काउंटर। वो नहीं है वहाँ पे, तो वो खुशी लोगों के चेहरे पे दिखाई देती है। हम गांव में कहीं पब्लिक प्लेस पे हैं, आते जाते लोग मिलते हैं, जो मेडिसिन वो ले रहे हैं हम ये वेलनेस सेंटर से, उसका फीडबैक बहुत अच्छा मिल रहा है। वो बहुत अच्छी क्वालिटी की है। उसका इम्पैक्ट लोगों की सेहत पे, और वो बोल के खुद बताते हैं बिना पूछे, तो बहुत अच्छा लगता है। तो मैं फिर से गुरुजी का, उनकी पूरी टीम का बहुत बहुत आभारी हूँ, धन्यवाद करता हूँ जो इस मिशन को शुरू किया। आप सभी लोग उसमें काम कर रहे हैं, और मैं बहुत खुशकिस्मत हूँ जो गुरुजी के इस मिशन में मुझे सेवा करने का मौका मिला। और आप सभी लोगों का जिन्होंने अभी पूरी टीम में, मेडिकल लाइन नहीं, जहाँ पे अब 4 दिन से हम यहाँ पर हैं, जो हमें खाना दे रहे हैं, इतना अच्छा हॉस्पिटैलिटी है, ट्रांसपोर्ट वाले भैया हैं, एक जगह से दूसरी जगह हमें लेके जा रहे हैं, सभी का बहुत 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 धन्यवाद।
Our next speaker is Mr. Shrikant Vuturi, Program Coordinator of Sai Swasthya Center in Jagtial. He has over 40 years of experience as a pharma distributor. He also serves as the regional head for Annapurna operations in the state of Telangana.
अखंड कोटि ब्रह्मांड नायक भगवान श्री सत्साई बाबा वारी पाद पद्ममुలకు प्रणमिलुतू my humble pranams at Sadhguru Madhusudan Sai. In 2015 year, we went to a breakfast center behind the graveyard. There we found 50 children. We started breakfast, and there one kid, Gayatri name, her name was 15-year-old girl, but seems like a 5-year-old girl. Her total, all the limbs were totally bent like this, and she was sitting like that in the school. I asked her to walk, but she unable to walk. What happened, I asked. So at the age of 9 years, she found that she is having a hole in her heart. She went to Puttaparthi, and there they diagnosed her and told her, now we can't able to do this surgery. You have to bear it, and you should do the physiotherapy. But the parents were helpless parents. Her mother, she used to sell the hair. She used to bring the hair, and she used to sell the steel utensils. As you know, the Deshadimaris, we can call in Telugu, ventricle ammi steel bollu konukuntaru. That is her mother, and father died. Grandfather died, but grandmother is also there. They are daily labor. So they are unable to feed her also. So in that way, mother used to bring her to school, and she used to keep her there, and she used to go to all work, and she will come in the evening. Then only she will take care of that. So how is that fate of these all kids? I don't know. Swami regularly told that you should take care of the children. The glow in the smiles, the glow in the face of the children itself indication of my presence. That Swami told. Then I remembered that Swami song. Sun lo dil ki pukar, sun lo हमको तुमसे प्यार कितना साई तुम ही जानते, दिलों के धड़कन तुम हो साई, तुम हमारे प्राण हो. Swami is our prana, and हमारा दिल का धड़कन है. So by thinking that so many kids are lying that, and no, they are helpless. Mothers or parents are unable to do. In another center also we found Hari Krishna with 3 limbs fallen. So in that case we were worried. Hari Krishna was not able to give a treatment. Her mother is not able to give a treatment to Hari Krishna because her father went to Dubai and she has to go to daily labor. Same like this. 7 o'clock they have to go for the work. Otherwise daily food will not be there. She has to buy milk powder and proteins and all the medicine to her kid. So she also used to do same thing. She brings her son and stays at a school, and she will go in the evening. She collects her son. That is the fate. They are searching for who will give the free treatment. In such a situation, we prayed Swami, how can we treat these people? Then Raipur hospital was there, and we sent this Gayatri girl to there. They have given physiotherapy, total diagnosis system, and we treated there with a orthopedic doctor in the Siddipet, near to Kondapaka. So she was okay. But then I prayed, how Swami, that much far, how can we go? And how these Hare Krishna, these all patients will get the treatment. In those days, we were thinking that like that. In the year 2023, our MLA came to Kondapaka to request Swami to give a Sai Swastha center to Jagityal also. By listening that they are opening so many centers in the country. Our MLA came and requested, and Swami graciously agreed it. And in the 2023 year, when MLA was inaugurating the center, another girl came. By listening this, Kondapaka girl informed a girl, her cousin, from Lakshadpet nearby our Jagityal. She came all the way and given a request to Swami. She is having 25 hole in her heart. And she is having asthma. And she is having fits. 8-year-old girl. Her mother is alone. Father left this family and went away. Her mother is a teacher. How can she manage this? We don't understand. So suddenly they came to know this and they gave application to MLSR, and we forwarded that application to Sarala. They came to Sarala. Here also, they have given 5 days time. You can go and come, either you can stay here for 5 days. After 5 days, Hiramasar will come and he will operate, they told. The mother stayed here only. But with worry, mother herself fallen sick, and last day, during the operation, she was collapsed. And mother also admitted in Rajeshwari, Black. For 1 week, Swami given graciously treatment, and Hiramasar operated her. Her mother has not seen her for 2-3 days also. And Hiramat sir came here and he gave not to worry, the courage given to the mother also. In that way, this news went viral in our area. Oh, Sai Swastha center came. So Swami can treat such children. Suddenly, one day, this Manikanta fast food center is there. In that, Bhutan person is doing this Manchuria fry. That person's daughter is also having a hole. She is 5-year-old, 15 hole was there to her. Since 2017, no treatment was there to her. So by seeing this news in the channel, they came to center by following a children's specialist. And they came again to Raipur and they treated it. Within 3 days they came. So these all things happened. After that, totally within the 1 year, 3,000 patients were treated and medicine were given nicely. By now, 1.5 years, 3,600 happily treated. And regularly, we used to monitor 600 hypertension patients and 300 diabetic patients also in once in 3 months also, or once in 6 months also. For them, actually nobody is there. The elderly people. If free center is not there, such people will never come and never take the medicine also. We went to a camp in Rajpalli district, Rajpalli village. There totally 250 patients came. In that, 100 patients are totally elderly mothers. And they are having 200 BP. What is it? How you are surviving? Why you are not using BP medicine? We asked. They said, just for headache, we are using the headache medicine. Just for the joint pain, we are using this sciatica medicine. What is happening? They don't know. We totally treated them, and please come to our center. You take the medicine also, we told them. But just 20 kilometers away, that village is, from 100 patients, not even 10 patients also not came. That is the situation. Mobile hospitals Swami is giving graciously. By that, so many villages were treated in north also. So these Sai Swasthyas were really a boon to us. thanks to Swami for giving this Sai Swasthya, and I praise Swami to bless us with more and more service. Thank you, Swami.
Our next speaker is Mr. Nagarajappa BK. He's a telemedicine assistant from ROD Center, Dodbellapur Taluk.
ಶ್ರೀ ಸದ್ಗುರು ಮಧುಸೂದನ ಸಾಯಿರವರ ಪಾದಕಮಲಕ್ಕೆ ನಾನು ವಂದನೆಗಳು. ಈ ವೇದಿಕೆ ಮೇಲೆ ಆಸೀನರಾಗಿರುವ ಗಣ್ಯರಿಗೆ ಮತ್ತು ಎಲ್ಲರಿಗೂ ಸಾಯಿರಾಮ್ಗಳು. ನಮ್ಮ ಆಸ್ಪತ್ರೆಯಿಂದ 25 ಕಿಲೋಮೀಟರ್ 65 ಹಳ್ಳಿಗಳು ವೈದ್ಯಕೀಯ ಸೌಲಭ್ಯಕ್ಕೆ ವಂಚಿತರಾಗಿರುವ ಜಾಗ ಆರೋಡಿ. ಈ ಜಾಗದಲ್ಲಿ ಸತ್ಯಸಾಯಿ ವೆಲ್ನೆಸ್ ಸೆಂಟರ್ ಸ್ವಾಮಿಯ ಕೃಪೆಯಿಂದ ಮಾಡಿದ್ದು 15 ತಿಂಗಳಿಗೆ 4030 ಕನ್ಸಲ್ಟೇಷನ್ ಮಾಡಿಸಿ ಎಲ್ಲರೂ ಉಚಿತ ಚಿಕಿತ್ಸೆ ಪಡೆದು ತುಂಬ ಆರೋಗ್ಯದಿಂದ ಕಾಪಾಡಿಕೊಂಡು ಎಲ್ಲರೂ ತುಂಬ ಸಂತೋಷ ಪಡ್ತಾ ಇದ್ದಾರೆ. ಇದರಿಂದ ನನಗೂ ತುಂಬ ತೃಪ್ತಿದಾಯಕ, ಈ ಸೇವೆ ತುಂಬ ಸಂತೋಷವಾಗಿದೆ. ಮತ್ತು ರೀಸೆಂಟಾಗಿ ನಮ್ಮ 65 ವರ್ಷದ ಒಂದು ಮಹಿಳೆ ನಮ್ಮ ಸಾಯಿ ಸ್ವಾಸ್ಥ್ಯಕ್ಕೆ ಬಂದಾಗ ಸುಸ್ತು, ಸ್ವೆಟ್ಟಿಂಗು ಅಂತ ಹೇಳಿರ್ತಾರೆ. ಆಗ ನನಗೆ ಬಿ ಪಿ ಚೆಕ್ ಮಾಡಿದೆ, ಡಿಜಿಟಲ್ ಬಿ ಪಿ ಚೆಕ್ ಮಾಡಿದಾಗ ವೇರಿಯೇಷನ್ ಬಂತು. ಮತ್ತು ಮ್ಯಾನ್ಯುಯಲಲ್ಲೂ ಮಾಡಿದಾಗ ತುಂಬ ವೇರಿಯೇಷನ್ ಬಂತು. ಆಗ ನನಗೆ ಡೌಟಾಗಿ SpO2 ಚೆಕ್ ಮಾಡಿದಾಗ 92 ಬಂತು. ಆಗ ಅವ್ರ ಮಗನಿಗೆ ರೆಫರ್ ಮಾಡಬೇಕು ಅಂತ ಹೇಳಿದಾಗ ಸರಿ, 5 ನಿಮಿಷದಲ್ಲೇ ಕಾರ್ ಅರೇಂಜ್ ಮಾಡಿಬಿಟ್ಟು ಆ ಅಜ್ಜಿಗೆ ಧೈರ್ಯ ತುಂಬಿಸಿ, ಏನೂ ಆಗಿಲ್ಲ ನಿನಗೆ, ಒಂದು ಬಿ ಪಿ ಚೆಕ್ ಮಾಡೋಕ್ಕೆ ಕರ್ಕೊಂಡೋಗ್ತಾ ಇದ್ದಾರೆ ಅಂತೇಳಿ ಧೈರ್ಯ ತುಂಬಿಸ್ಬಿಟ್ಟು ಆಗ ನಾನು ಅವ್ರಿಗೆ ಹೆಚ್ಚಿನ ಚಿಕಿತ್ಸೆಗೆ ಎನಿ ಎಮರ್ಜೆನ್ಸಿ ಕೇರ್ ಅಂತೇಳಿ ಎಲ್ಲನೂ ಆಗಲಿ ಇಮಿಡಿಯೇಟಾಗಿ 55 ಕಿಲೋಮೀಟ್ರ್ ಇದೆ ನಮ್ಮ ಹಾಸ್ಪಿಟ್ಲು, ಬೇಗ ಎಮರ್ಜೆನ್ಸಿ ಕೇರ್ ತಗೊಂಡೋಗಿ ಅಂದಾಗ, ಇಲ್ಲ ನಾನು ನಿಮ್ಮ ಆಸ್ಪತ್ರೆಗೆ ಹೋಗ್ತೀನಿ, ಸಾಯಿರಾಮರ ಆಶೀರ್ವಾದ ನನಗೆ ಇದ್ದೇ ಇರುತ್ತೆ, ನಿಮ್ಮ ಹಾಸ್ಪಿಟ್ಲಿಗೆ ಹೋಗ್ತೀವಿ ಅಂತೇಳಿ ಅವರು ನಮ್ಮ ಎಮರ್ಜೆನ್ಸಿ ಹಾಸ್ಪಿಟ್ಲಿಗೆ ಬಂದಿರ್ತಾರೆ. ಬರೀ 28 ನಿಮಿಷದಲ್ಲೇ ನಮ್ಮ ಆಸ್ಪತ್ರೆಗೆ ಬಂದು ಸೇರಿ ಅವರಿಗೆ ಅದೇ ರಾತ್ರಿ ಓಪನ್ ಹಾರ್ಟ್ ಸರ್ಜರಿ ಮಾಡಿ ಅವರು ತುಂಬ ಗುಣಮುಖವಾಗಿದ್ದು 1 ವಾರ ಬಿಟ್ಟು ನಮ್ಮ ಸಾಯಿ ಸ್ವಾಸ್ಥ್ಯ ಕ್ಲಿನಿಕ್ಕಿಗೆ ಬಂದು ತುಂಬ ಸಂತೋಷಪಟ್ಟು ಅವರ ಸಂತೋಷ ನೋಡಲಿಕ್ಕೆ ನನಗೂ ತುಂಬ ಸಂತೋಷ ಆಯಿತು. ಇದೇ ರೀತಿಯಲ್ಲಿ ಅನೇಕ ರೋಗಗಳಿಗೂ ತುಂಬ ಚಿಕಿತ್ಸೆ, ಮತ್ತು ಡಯಾಬಿಟಿಕ್ಕು ಮತ್ತು ಹೈಪರ್ಟೆನ್ಷನ್ ಅವರೆಲ್ಲರೂ ನಮ್ಮ ಕ್ಲಿನಿಕಲ್ಲೇ ಸ್ಟಾರ್ಟ್ ಮಾಡಿಕೊಂಡು ಎಲ್ಲರೂ ಸುಮಾರು 100 ಜನ ಹೈಪರ್ಟೆನ್ಷನ್ನು ಮತ್ತು ಡಯಾಬಿಟಿಕ್ ಅಲ್ಲೇ ಚಿಕಿತ್ಸೆ ಸಿಗ್ತಾಯಿದೆ. ಅದು ತುಂಬ ಸಂತೋಷ ಆಗ್ತಾಯಿದೆ. ಮತ್ತು ನಾವು ಇಲ್ಲಿಗೆ ಯಾವುದೇ ರೆಫರ್ ಮಾಡಿದ್ರು, ಯಾವುದೇ ನಮ್ಮ ಆಸ್ಪತ್ರೆಗೆ ರೆಫರ್ ಮಾಡಿದ್ರೆ ಎಲ್ಲರಿಗೂ ಒಳ್ಳೆ VIP ಟ್ರೀಟ್ಮೆಂಟ್ ಸಿಗ್ತಾಯಿದೆ. ನಮ್ಮ ರಘುಪತಿ ಸರ್ ಅವರು ಹೇಳಿದ್ದಾರೆ, VIP ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಡ್ಸೋಣ ಅಲ್ಲಿಗೆ ಬಂದು ಇಲ್ಲಿಗೆ ಬಂದರೆ ಅಂತ ಹೇಳಿ ಸರ್ ಹೇಳಿದ್ದಾರೆ. ಅದೇ ಥರನೇ ನಮಗೆ VIP ಟ್ರೀಟ್ಮೆಂಟ್ ಸಿಕ್ಕಿ ಎಲ್ಲರಿಗೂ ತುಂಬ ಸಂತೋಷವಾಗಿದೆ. ಇದೆಲ್ಲ ನಾವು ಮಾಡಬೇಕಾದ್ರೆ ಒಂದು ಎನರ್ಜಿ ಬೇಕು. ಆ ಎನರ್ಜಿನೇ ನಮ್ಮ ಸಾಯಿರಾಮ್ ಆಶೀರ್ವಾದ. ಇಷ್ಟು ಹೇಳಿದ್ದಕ್ಕೆ ನನಗೆ ಅವಕಾಶ ಮಾಡಿಕೊಟ್ಟ ಎಲ್ಲರಿಗೂ ನನ್ನ ಸಾಯಿರಾಮ್ ವಂದನೆಗಳು.
For the benefit of all, a quick translation of what he said. Mr. Nagarajappa shared that the ROD Center serves around 15 villages which need a lot of support for NCDs. Recently, a 65-year-old lady came to the center with a lot of discomfort and sweating. She had high BP and reducing O2 levels. The team gave her confidence and immediately referred her to the medical college's emergency unit. She was operated that very night and was discharged within a week. She's now doing very well. So he went on to say how the team referred 3 to 4 such patients who are now very healthy. The center has till date completed 4,000 consultations, and it is this service, he said, that brings him immense satisfaction. In all our endeavors, technology is a key enabler aimed at process efficiencies, personalized care continuum, and periodic monitoring. Today, we are set to launch the website and hospital information management system of Sai Swasthya and Sai Arogya. May we request brothers Pala Sitaram and Vinod Raj from the IT team of Prashanti Balamandira Trust to present the Sai Swasthya website to Sadhguru for the launch. Next, we request brothers Pramod Ishwarappa and Sai Ram Boddu to present the HIMS platform to Sadhguru for the launch. The entire system has been developed in-house by our own engineers. A big round of applause. May we now invite Dr. Prashant Garg, Executive Chair, LV Prasad Eye Institute, to address all of us, an internationally renowned leader in corneal infections, antimicrobial resistance, and eye banking. He's a recipient of numerous national and international awards. Over the past 25 years, he has held several leadership positions in the organization and has over 190 publications in peer-reviewed journals. Dr. Garg, please.
Sai Ram. I consider today extremely blessed to be present among you. It's really an occasion that we are discussing issues which is at the core of World Health Organization. Almost about 50 years earlier, World Health Organization set a goal where health was considered a fundamental right, and health was defined on two parameters: not just its availability to all, but also focusing on quality. At that point of time, we had no knowledge about how, with a very limited workforce, which primarily comprised of doctors, nurses, and some recognized paramedical workforce? Can we cater to the population of the entire world and specifically serve the healthcare needs of those who are most vulnerable? They proposed some ideas which unfortunately have not yet been taken forward. And one of the idea was to strengthen primary care. While this looks like that we should be able to achieve, but if you go in the depth of it, you will realize that we still do not understand what it means by primary care and how we will be able to sustain it, particularly in remote rural areas. I think today, if we look into the model of Sai Swasthya Kendra and combine such centers with technology, we see a ray of hope that soon we are going to be able to cater to the healthcare needs of people in remote rural areas and particularly those who are vulnerable. Yet another challenge that we are going to face is more related around sustainability. And this question we still need to find an answer to. I belong to an organization which is committed to alleviating needless vision loss from our society. The organization was founded in 1986 by our founding chairman, Dr. Gullapalli Nageshwar Rao, who returned from United States having a very good practice and professional career, realizing that the healthcare needs, and he was focusing on eye care, is much more in his country than what he is practicing. Today, because of his vision, we are present in 310 locations in 4 states: Telangana, Andhra Pradesh, Odisha primarily, and in a small portion in Karnataka. 270 of our presence is for primary eye care, where the services are provided in rural areas at no cost to patients. Here we aim to take care of uncorrected refractive error, which is one of the most important causes of needless vision impairment. A 2-year trained technician is able to examine these patients, detect and identify those patients who can be benefited by a simple pair of glasses, and is able to dispense those glasses. Any patient who is found to require more advanced care are connected to secondary and tertiary care through teleconsult and are referred appropriately through a very well organized and interconnected system, either to secondary center or tertiary eye care center. In our network, we have a center of excellence at Hyderabad. We have 4 tertiary eye care centers in the cities of Vijayawada, Visakhapatnam and Kadapa, and 1 center in Odisha. We have 25 secondary centers which typically cater to population of 500,000, and each of these centers are linked to primary care which are catering to population of 50,000. In addition, to reach out to even remote areas and even in the tribal areas, we conduct community screening program, which we call community-based primary care, whereby the person from the community goes from door to door screening people for their visual needs and making appropriate referral. Today, when I visited this center, I found a parallel example of a model which is much needed to cater to the healthcare needs of our society. I will like to congratulate all people who are involved in Sai Swasthya Kendras and are able to take healthcare to wherever it is needed. I think it is the need of the hour that with the understanding of the healthcare needs in our society and the technology, we should all work to make the dream that World Health Organization once put of making not only healthcare as a fundamental right, but realizing by making it available at an affordable cost and using a model which can be accessed by the local communities. With that, once again, I like to thank Guruji and my God for giving me this experience, and I consider this day as one of the most memorable day in my life that has enlightened me. Thank you very much, and Sai Namaskar.
Thank you, sir. May we now invite Dr. Sanjay Kumar to address all of us. He serves as the member of the Legislative Assembly from Jagtial. Known for his grassroots connection and progressive leadership, he has been instrumental in driving development initiatives in the region. An eye specialist by profession, he has performed over 20,000 free eye surgeries across his constituency. His guiding motto is Seva to the helpless, a principle he lives by every single day.
Good evening, my dear brothers and sisters. And Holy, His Holiness, Sri Sadguru Madhusudan Sai Ji, respected senior doctor, just now, as he has told, they are giving world-class treatment and at the same time serving the poor. And one of the eminent ophthalmologists, Dr. Prashant Gargaru, dignitaries on the dais, off the dais. Namaskar, Saira. As far as myself is concerned, not only as a legislator of the Jagtial Assembly constituency, coming from a political family, agriculture family, almost from 4.5 decades, I used to follow very closely Jagtial senior eminent citizens or philanthropists serving the poor through Lions Club, Rotary Club, like so many social organizations. And the Sathya Sai organization also. Many of the doctors also have come here. Since 4.5 years, 45 years, they used to go to Puttaparthi and Jagtial also. They have established a center. Later on, under the leadership of Srikant, Srinivas and their friends, they have started with the blessings of Guruji, Sri Sai Swastha Wellness Center also. I was the president of Jagtial Indian Medical Association and Nursing Home Association of Karimnagar district also. My friends, my colleagues, Dr. Nagaraj Garu, my sister, Dr. Kanaka Durga, Santosh, his wife, they have also come here, and Sathya Sai followers, Gangadhar, they all are also here, sir. They all are doing extremely great job. Many doctors also attending this Sai Swastha clinic, treating the poor, going to the villages, treating them. See, I am in the government. Last time also I was in that government. Now I am closely associated with the Honorable Chief Minister Garu, Sri Revanth Reddy Garu. Not only as an ophthalmologist, I have my own clinic, I have my junior colleagues running my hospital. I do weekend some social work. But later on, with the blessings of God and the blessings of Sai Baba and my area people, I could able to do some extended service into many aspects like in irrigation, education and health. And I have requested the then Chief Minister and established a medical college also there. So that is all of one part. But if you see here, love all, serve all. See, loving our own people, especially the poor and needy, that is more important. Many a times government do many things. Try to give education or health to the poor. But the love, what the Sathya Sai devotees are giving through these organizations are many times not reached. Many government servants are also doing service, but not like this. So the approachability also is very, very important. Many times we were not able to approach us also. So Sai Swastha Clinic, through your organization, sir, I used to hear, because I have not visited Puttaparthi. As a doctor, or from the beginning, I am myself from a political family. I used to hear a lot of patients got treated there. Many of my relatives and friends' children have studied, got educated. And not only getting educated, they're so disciplined, so disciplined. So now I request the Honorable His Holiness Sadhguruji, sir, I have visited Kondapaka Medical Center, sir. Last time when I have given you in writing representation to start a Swasthya clinic, immediately you have sanctioned. I thank you one and all, sir. Once again, sir. Once again, Swamiji. Even though number of hospitals, government hospitals are there, as our Prashant Gargi has said, world-class center like L.V. Prasad is there, but still we are not able to cater the poor and needy in all aspects, especially health aspect. Okay, ophthalmic side, definitely, as Prashant Gargi said, they are doing extremely great job there, but in different other aspects like cardiology, oncology, nephrology side, every day, because I am a senior doctor also, and legislator. Every day, people come with a very sad situation, asking for help for the treatment. Okay, as a senior doctor, because I am around 62, most of the doctors are junior to me in government service. They all honor my letter or my telephonic call, they attend it, but still there are no beds, no ventilator. There are certain situations still we are facing in this after 75 years of independence also. After seeing a hospital like here, today I met an young girl from Chegityal studying here, sir. Felt very happy. I met her parents also, Gangadhar, and their family, very poor family. So by establishing such a great institute here, you are really helping the poor. You are the living God, sir. So I take this opportunity to request on behalf of our people to establish many more centers and advanced centers there, sir. And any support from the government side, being approachable to Chief Minister, having access to the Chief Minister of Telangana, Sri Revanth Reddy garu, I will do my best from the government side also. Thank you, one and all.
Thank you, sir. This evening is indeed special, with both our speakers being ophthalmologists, and it is heartening to note the alignment of vision that we share together. We would like to offer a token of our love and gratitude to both our speakers for taking their time out and sharing their valuable insights with us this evening. Dr. Sanjay Kumar, thank you, sir. Thank you for being with us today. Dr. Prashant Garg. Every member of Sai Swasthya is an ambassador of compassionate healthcare. Today, we celebrate their dedication and commitment towards this mission by felicitating 8 outstanding individuals. We will begin with the Leadership Excellence Awards. As we call out the names, we request each of you to please come and receive Sadhguru's blessings. Mr. Manjunatha Reddy, MV. Mrs. Dipanvita Mukherjee. Mr. Sanjay Lakhandri. Mrs. Karuna Raju Mantena. We will now have certificates of excellence handed over to Dr. Arshdeep Singh. Mr. Sudeep Patra. Ms. Chaitra C. And Mr. V. Venkatesh Shrikant. Thank you, Sadhguru. May we now invite Dr. C. Srinivas, Chairman of the Sri Sathya Sai Health and Education Trust, to address all of us. A healthcare visionary, Dr. Srinivas set up the network of the Sri Sathya Sai Sanjeevani Pediatric Cardiac and Mother and Child Hospitals under the guidance of Sadhguru Sri Madhusudan Sai. Till date, we have conducted close to 37,000 totally free of charge child heart surgeries. A big round of applause. Dr. C. Srinivas.
Offering our heartfelt pranams and namaskar at the feet of Bhagwan Sri Sathya Sai Baba and our ever so dear and revered Sadhguru Madhusudan Sai, respected brother Narsimurthy ji, most eminent Dr. Prashant Garg ji, Sri Sanjay Kumar ji, all those tireless champions of service of Sai Swasthya movement galloping across the length and breadth of this country, sisters and brothers, and I think students who are present here in this sacred and hallowed presence. From what one heard in the last few minutes from the speakers, one can only be so moved and inspired by their commitment and dedication and conversion into tireless service into the very unserved parts and terrains of our country. To me, every single member of Sai Swasthya is not just a doctor, is not just a caregiver, is not just a tireless worker at the grassroots level fighting the battles that only he or she would know. To me, as I heard and as I was seeing them, I think you are nation builders. You are building the new India which we dream of and we wish for. I have reason to say that because I, for one, know that in quantity this is only going to grow and grow. When Bhuvana mentioned to us that to date over 300,000 men and women, children across the country have been served, I, for one, always feel health does not align to mathematics. The laws of mathematics do not apply to health. In mathematics, 10 plus 10 is equal to 20. But in health, each Sai Swasthya member must remember 10 plus 10 can be 100, can be 1,000, can be 10,000 or much more. There is reason for this. Because when you provide care, as was expounded by every single speaker here, in every single example that they narrated to us, what was done? You have touched people in their time of utmost need. There is a lot of difference when doing an inanimate multiplication or addition of a number to a number. But when you touch somebody and provide them love, care, and possibly cure, you are sowing the seed of infinite growth there. That member who was served by you in that remote area or geography or terrain will remember every Sai Swasthya worker deep within their heart. And that goodwill and gratitude will grow when that one will translate into societal good of 10, 100 or many more. So to me, Sai Swasthya therefore, and I'm sure Dr. Prashantji, the dream of WHO, slowly but surely will be reached by movements, because these movements carry with them such passion and devotion and that seva bhav. What I saw as the differential in Sai Swasthya is the third S, which is so vital in health, which even Sanjay Kumarji was lamenting that every day he comes and gets requests for health care. What is needed primarily in health today? You can get the best medical education, you can get even access to the best technologies, you can have the best experience by operating on volumes and varieties and spectrums of cases. But like Sai Swasthya is slowly doing, it is instilling in each of our hearts the bhava of seva. To me, seva is another word of Sai Swasthya. And I think if there is one virtue which is going to make a difference, it is this virtue of seva bhav, which is so important, that Sadhguru Madhusudan Sai is tirelessly both exemplifying through his life and also making so many others also practice. Like it is said, nobody is going to be bothered about which car you drove, which home you lived, what you owned, what you achieved, but how many hearts did you touch? How many lives did you touch? How many lives did you make a difference? And that is what you are building India, one life at a time, one day at a time. So remember, you are the agents of transformation. Transformation many a time is slow and unseen. Like the seed which is sown into Mother Earth is never seen. But when the tree comes up, when it blossoms into a beautiful tree giving shade, flower, fruit, and so much of vital air to the world that we live in, that happened because of that seed. Puvana also said that you will achieve 1 million. I might think you might surprise her by crossing 1 million. 1 million is no small thing, because with the momentum and motivation that you have, numbers can become just mythical, you know. In a country with 143 crores, I would think your propensity and ability will be far more than that. And I like the term wellness. And I think you should also align and live up to the word wellness. And I have a reason and a purpose in saying this. Doing a little work in providing a little care and cure in one's life, increasingly I feel hospitals are institutions of wellness. Let us begin the redefining of this very word. Yes, they do alleviate suffering, cure a disease, whichever disease or ailment it might be, but let us rework the working of an institution of health. Let us provide what is our birthright, which is wellness and well-being. Why can't hospitals be places of such transformative, happy experiences to people? Why should there be morbidity in a hospital? Why should there be fear and anxiety in a hospital? People should come to a hospital more because they will see themselves so well, so powerful in their being that they can go out to become agents of transformation. And that, in essence, which also Prashant ji mentioned, was the definition of health in WHO. So I think if there is one institution, it is Sadhguru Madhusudan Sai's institution, which should redefine the word hospital. To me, it is a personal mission that we consider a hospital a most happy place. Why shouldn't hospitals be happy? Why shouldn't people come to look up, to find hope, positivity, courage, and strength? Bodily cure certainly will be done, but they will go out transformed. And I think that message of transformation, Sai Swasthya, must invest upon. Wellness is our birthright. And I think that is where, if you would also, because of the paucity of healthcare providers in our country, align to the ancient schools of Indian medicine, the great Ayush, as it is spoken about, of which I am a great fan myself, of Ayurveda, of yoga, of Unani, of Siddha, and homeopathy. I will give you one example, and I think that will delight everybody here. We run a few mother and child hospitals. We, of course, see about 5,000 mothers every day. That's a small number compared to the whole world that we are living in. And we have, which might give you some happiness and some joy, we have a department of maternal yoga in our mother and child hospitals. And I have found great depth, profundity, and power in maternal yoga. I'll give you 3 classical examples because so many gave us examples. So there is a maternal yoga practitioner from Banaras Hindu University who works with us, Dr. Jayashri. She conducts in the Mother and Child Hospital, of course, primarily in Raipur, practices of yogasanas, of chanting a mantra, of pranayama, and basically Omkara. You can put your hand on your heart and maybe on your mouth. She has brought about a revolution that the percentage of cesarean births has fallen by 50% through the practice of yoga. She has brought down the percentage of preterm births by 60% through the practice of yoga and pranayama. And something which is astounding and which Sai Swasthya should think of taking up is this whole rage in maternal health of infertility and infertility clinics that are propounding every single street in every city and town today. Mothers who for 2, 3, 4 years did not conceive, just through the practice of incessant meditation and Omkara, have become mothers today. If the power of investment into our ancient culture and the power of our spirituality can be aligned, hospitals can become temples of wellness. And that will happen through Sai Swasthya. God bless each and every one of you.
On behalf of all of us, we pray to Sadhguru to bless us all with his divine message.
on this very special occasion of the All India meet of all the Sai Swasthya members, which has been a 2-day program. Now with this evening we conclude it. And this evening has been graced by very eminent people, as they are on both of my sides. Sanjay Kumar ji, Dr. Sanjay Kumar, he has been an associate of our institutions, a patron, and also the cause for Sai Swasthya in Jagatiyal. It was he who came all the way, and he mentioned with a letter in hand to start a center over there. And I'm very happy to hear Srikant saying that many good things are happening through that center, including pediatric heart surgeries that have happened in our pediatric heart hospitals because they were referred from that center. So it makes us very happy. Thank you for your kind presence today, this evening. I also have a very eminent personality, Dr. Garg from L.V. Prasad Eye Institute. Dr. Garg, I went through the entire website, the story of L.V. Prasad, the inspiration behind, and Dr. Jean Rao's vision of bringing eye care to the rural masses, to the common people. It really inspired us, and it so very well aligns with the idea of Sai Swasthya as clinics that are catering to the rural India largely. And I look forward to a long-lasting association, a mutually fruitful one with the Institute, and I hope we can speak again to further the cause of universal healthcare coverage. Dr. Srinivas, the pioneer in pediatric heart and mother and child services around the country, and now we are the largest chain of pediatric heart hospitals with no billing counters, doing the largest number of cases in the whole of the country. And in a span of just about 10, 12 years, all this has happened, and now they have expanded beyond the geography of India to other countries also. Now Sanjeevani is present in Fiji, Sri Lanka, and recently a mother and child center was started by supporting the existing center in a hospital in the US, in Mississippi, a small region called Clarksdale, the poorest state in the US. So the mission is expanding. Yet, while it is broadening its horizons, it is also deepening its offering to the people. And that's how Sai Swasthya is becoming an extremely crucial step in integrating primary with the tertiary healthcare facilities that we are creating. The three vertices of this vision were, of course, early detection, so that people don't go undiagnosed and end up in a tertiary emergency. The second was care continuum, that they should not be just diagnosed and left high and dry, but they must be taken to the next level of services at the secondary or tertiary care as it's necessary, and they should be provided that completely. And of course, the third word is timely referrals. Many of the people, if they are not referred on time to the right kind of center, the time lost is life lost. And that is something that I heard from many of these our members, some of them the Dotbalapur story, that how a timely referral to a tertiary care center and diagnosing it on time has led to saving a life. Saving a life means saving a family at times, saving a whole generation at time. So this is a tremendous work, and I must congratulate and convey my heartiest wishes to all the members of Sai Swasthya, their mentors, the doctors, the paramedics, nurses, volunteers. And what is so beautiful is that how community is becoming an integral part of this program. We started alone, but then the community has joined us, and they have owned up this program. I think community ownership is so important to make such health initiatives succeed, because the health-seeking behavior in our country is quite low. To encourage that, the community must take the ownership of it. And we have seen the community ownership, whether it's in Annapurna program, which is nutrition program. We have seen the principals and teachers and the panchayat members and the local volunteers take charge of the Annapurna morning nutrition distribution. Similarly, now in Sai Swasthya, we are seeing the community ownership, and people are getting trained. And the example that Dr. Nazreen gave from Bengal was about empowering the rural women. And now they are almost managing the center. This is wonderful to hear. And I told yesterday I wanted to hear what you people have to say. So it's very, very fulfilling. Dr. Ashdeep Singh talked about how in some remote corner of Punjab, where he's been working for 20 years, he always prayed for a center, a healthcare center where free healthcare delivery will be possible. And today, because of that, stars align and he meets his old colleague, and then this happens. So also in so many places, be it Andhra Pradesh, be it in Telangana. Now I'm told we are in 9 states at this point in time as we talk. And I'm sure in coming times, many more will happen. While we are expanding this to ensure that no person is left behind. And that is the motto of Sai Swasthya. No person is left behind. Everybody gets access to quality healthcare we are giving it at zero cost, but let us say at a very available and affordable cost. This is something that was going to revolutionize the vision of Sarve Santu Niramaya, which is our India's vision of let everybody be healthy. May everybody be healthy. And if they're not healthy, let there be a system, a platform, an opportunity to become healthy because of such initiatives. So again, I want to congratulate everybody. Meanwhile, I also took some mental notes from whatever I heard from everybody else, and we will definitely implement those as well in the future. In this word, swastha is a Sanskrit word. Swastha. Swa means self, stha means being. Being yourself is being healthy actually. That is what our scriptures say. Swastha is the state of being yourself. When you are not yourself, that is when you become unhealthy. It means when you are not mentally, emotionally, physically and spiritually aligned. Manas sanyat, vachas sanyat, karma nanyat. Your thought, words and deeds don't align. That is the beginning of diseases. That is the beginning of issues. So it's not just about physical alignment. It is the mental, emotional and spiritual alignment which completes the definition of health. If you go to Ayurveda, it defines health very simply. I don't want to get into technical detail, but it says samadosha, samagnischa, samadhatu, malakriyaha, prasanna atmaindriya manaha, swastha iti abhidiyate. It means dosha, means three doshas there, vata, pitta, kapha, air, water, fire components in our body. They have to be balanced. Then our agni, the metabolism should be right. Then dhatu, the components of our body, the bone, the blood, the plasma, the muscles, the bone marrow, and reproductive system. Everything should be working fine. That is the other things. And of course, your excretory system should be working fine. If that's not happening, then you know that you're not healthy. But these are physical parameters. Long back in ancient India, our Ayurveda defined that health is not just the physical side of it. There is beyond greater idea of health that exists in India. It says, prasanna atmaindriya manaha. Prasanna, a state of happiness, wellness, what Dr. Srinivas said. A state of being yourself. You're joyful, you're happy. That, and what should be happy? Atma means your inner self should be happy. Indriya means all your senses should be happy. And manaha, the mind should be happy, your thoughts should be happy. Thought means all emotions should be happy. When all this happens, then a person is considered as healthy person. Swastha ityabhidiyate. Such a person alone is healthy. Physical health is alone not health. Everything should be a mental, physical and spiritual, atma. All that is when aligned, that is when health is considered as complete. So Sai Swasthya was started this with the idea that it is not a clinic, it is a wellness center. And wellness means all these aspects have to be integrated into it. Well, baby steps are being taken to first ensure that the physical disease is treated immediately so that the person is at ease, not dis-ease, but at ease. And then you can talk to them about the higher things. And I'm told that certain Sai Swasthya centers are going beyond the call of duty and even educating people about the consequences of not eating right. When your indriyas are not happy, you eat something that destroys your metabolism or interferes with your body systems. All the NCDs are the outcomes of wrong eating, wrong living, wrong thinking, wrong habits. Smoking, drinking and such other social evil habits are present in the villages. So our Sai Swasthya is going one step ahead, even talk to people about that and ask them to control that in order to make sure that all these medications work for them. Not just that, they've gone a step ahead and even providing nutrition to the women who come with low weight and anemic and things like that. So yeah, it is a multiple approach, and include yoga in it. As Dr. Srinivas is saying, we have seen the effects of it, and you have a complete package, a complete wellness package. And that is what we can offer to the country at the very primary level, which is otherwise extremely difficult because reach is difficult. Healthcare professionals don't go there. But today, as I said, this is the right time. Our Prime Minister keeps saying, yahi samay hai, sahi samay hai. This is the right time to do the right things. Why? One, technology has leapfrogged in the last 10 years. We tried telemedicine 5, 6 years, 10 years ago, didn't work because internet connectivity was not there. People were not used to devices. People were not comfortable with tele-consultations on a screen. But COVID changed everything. I think that was the opportunity in the adversity, where people got used to talking to each other on the phones, to their children, to their people in the family, because that was the only way you could communicate. Now that has really helped the telemedicine. People are comfortable talking to a doctor. Otherwise, Indian idea of doctor is you must sit across and talk to them face to face. But now that is changed. Two, the internet reach in the country has increased. And good high-speed bandwidth is available in very remote areas also. And that has again made a big difference to why Sathya would succeed now and wouldn't have succeeded 10 years ago. Third, point-of-care devices. Today we had demonstrations of some of them from the foundation as well as from other agencies. Now, the more we use these point-of-care devices, the faster we give access of healthcare to the people. Of course, a lot of things are still progressing, much more will happen. The costs will come down as time progresses. Today, it is still a slightly prohibitive kind of a cost, especially if you want to do blood work. But I'm sure in next 3, 4, 5 years, because of innovations, these costs are also going to come down. And the technology of healthcare management systems, seamlessly integrating the data collection, data analysis, and the further processing of data, which I want to congratulate our IT team for having developed it in-house, because it is otherwise quite expensive. As charities should find ways to reduce its unwanted costs. And that is something that our team has achieved with the help of many well-wishers. I'm very happy about that. So I think all that data should be integrated so that when a patient moves from a Sai Swasthya database to a Sai Arogya, which is the secondary care center data, there should be seamless transmission or transfer of data without any lag, so that we don't repeat or we don't make mistakes in understanding, assessing. I was told that soon they are going to even integrate their scans and radiology scans also into the system, so that now the doctor sitting in Bapatla, let us say, he can, once he gets the patient referred by the Sai Swasthya with the diagnostics, he should be able to see everything and immediately give an answer to the problem that is there and further refer it. So timely referral is very important. And that all is possible through technology, which was not possible 10 years ago. I have met people in the US who tried this 20, 30 years ago because they thought what is possible in US should be possible in India, but it wasn't so. The technology wasn't there, the acceptance wasn't there, the internet wasn't there, and the people's comfort wasn't there with technology. Now all that has been achieved. So this is the perfect time to launch and expand this model of Sai Swasthya. It is on the practical side of things. So I'm very hopeful that this will grow very fast. And yes, as Bhuvna was saying, 1 million screenings or 100 centers, I'm sure you will surprise me by the end of this year by doing much more than that. And I'll leave the numbers to you, because numbers are simply some milestones, some goals to work towards. But I'm sure more can happen as we keep growing, and listening to the stories, the commitment, the passion of the people who are working at the grassroots levels. That makes me very happy. I know it's sometimes a back-breaking journey for our mobile hospitals to go through all those rugged, whatever, village roads, and you come back with your spine, realigned. And probably you need to go to the center first. I've seen that happen. And I've seen vehicles get spoiled on the way. And when we are talking to some tribal areas, when somebody who had never done this, he came and told, Swami, just give us a mobile vehicle, we'll manage. I told, forget about it, you cannot manage. You don't have roads that these vehicles will get spoiled in 3 months. No doctor will travel in that. These are not practical solutions. We have to think beyond these traditional ideas. But technology is making a big difference, and I think I'm very hopeful. I keep traveling around the world learning about new healthcare technologies, wearables, remote monitoring devices. We are also investing. We started a research and innovation center which is also working on some of these ideas to bring down the cost of diagnostics or monitoring or patient care to bare minimum, so that more people can be served. But these are all the technical side of things, how Sai Swasthya is being envisioned as a game changer in the idea of universal health coverage. But the biggest advantage of our Sai Swasthya is that you don't only just diagnose and leave the patient high and dry, but you can pick up the phone, contact the nearest of our hospital, whether it is Sanjeevani or it is a medical college here or our Arogya hospitals anywhere. You can just pick up a phone and tell, I have a patient, he must be treated, I'm sending the patient across. And the patient can travel and get the full treatment here, like many of these cases were quoted. Not many NGOs can boast of this in multi-speciality space. Not many. Because they can provide you the basic diagnostics perhaps, but then they don't have the wherewithals, the means to do the care continuum. They'll have to leave the patient where it is, and that's even worse, because once you diagnose somebody with a cancer and tell them now you have a cancer and your life is going to be difficult, and you don't give an answer to the question of cancer, you just leave them without an answer, that's not good at all. So that is something that we are changing. The goal is to build one center in one taluka at least to begin with, so that everywhere we are there. And then to support that with a secondary care, to begin with 100 Sai Swasthya, a secondary care general hospital which takes care of first level of problems. And as I said, the pyramid, when it is upside, the bottom is the Sai Swasthya, the middle is the Sai Arogya, and the topmost is all the tertiary care that we do. But when I think of the care, it should be the reverse pyramid, you see. Most of the problems should be solved at Sai Swasthya level, fewer problems at the Sai Arogya, and hardly any to the tertiary care. We should be able to manage as much as possible within the first two layers. So these are the two pyramids that we must work towards. And that will be the future of this program. I'm very happy that all of you have taken such effort and with passion. Nobody has been forced to do this. If somebody from the company joins us, it's because of their happiness, their joy. Dr. Arshdeep was telling it is his joy to be a part of it. And they feel blessed and privileged. See, that is the idea of healthcare. It is seva. And seva is a privilege. To do seva is a privilege. Many people think seva is a burden. Why should I go and do something for no benefit for me? But doing seva is the privilege. Giving is the joy. And that giving is something that is happening through you. You are very blessed because God only gives. Nature gives. The good gives. So you are getting an opportunity to give your services through these platforms. I'm not sure how many of us on our own individually would have taken up a task like this. But in this collective, whatever the unity and the synergies that come out of it, that makes things happen. 10 plus 10 becomes 10,000. And that is what is happening with each one of you. I'm sure in times to come, much more will happen. We have a whole lot of doctors and nurses and paramedics getting ready. They're all sitting behind you. And I'm sure they all come from small towns and villages. I think hardly 20% are from the cities. 80% of them are from small towns or rural areas. These are the people who will come in the future and support you. They will be available to you over the phone and over the device to get consultations and help. And I will send these people all across the country as a part of their internship. That is why I asked them to attend all the meetings so that they know what's coming next for them. And I'm sure they are ready for it. Aren't you ready? That's not loud enough. Yeah, so you have got hundreds of them getting ready for you, and they'll support your initiatives. Keep doing good, keep at it, don't give up, because the one who is suffering is also a member of our family, the family of humanity, and taking care of him is taking care of our own family. I'm not saying we can solve all the problems of the world, but I know we can solve a world of problems for the person whom we are treating. I always say we may not be able to make a difference to the world, but we do make a world of difference to that one person whom we care for. So keep making difference to the people and the community and the country and the world at large. And with these words, once again, thanking everyone who has participated in this event. I look forward to the next year's meeting. This year is very busy for us. I hope that in next year when we meet after November, not even next year, maybe in December, we would come back to celebrate more such achievements more such service opportunities that we have worked on. And I hope to bring some patients also next time to hear their side of the story and know that how this is making a difference. So lot of blessings to every one of you. Please go back safe and be healthy. You be healthy first, and not just physically healthy, the Ayurveda concept of health. Be mentally happy and joyful. And this will happen because what you are doing, you enjoy it. You are being yourself. You couldn't have done anything else to make yourselves happy. If somebody asks me, Swamiji, how can you do this all the time, or every day of the year and every hour of the day? I said, because this is what I am. This is what is fast for me. This is my joy. If I do anything else, I won't be happy. I'll fall sick. So I'm keeping my health because I'm doing what I love to do. And my mind, thoughts, words, everything is aligned. And that is what you should also be enjoying, that kind of a health, the complete wellness. And that is the idea of our scriptures. So blessing all of you to have very good, healthy, long, happy lives, so that you can also help many more people become healthy and happy. And looking forward to meeting all of you again in the month of December, towards the end of this year. But of course, you all will be invited for the inauguration of the next big hospital. You saw that next door, and many functions in between. And I hope when we meet in December, we will be there in every state of the country and beyond. So much more is to be done. And as I said, the one who does good is rewarded with doing more good. So reward for good work is more good work. It means more hard work, but more joyful work, more service. With these words, I conclude and wish you all a safe and happy journey back to your homes.
With this, we conclude the two-day meet. Thank you all for coming from such far places and joining all of us here. Thank you very much. We will have a short break now and then come back for satsang.